here we are, the second phase of the vaccine rollout. NAFDAC has been preparing for this for about a year now. So you can ask yourself, why should I take the vaccine? Because NAFDAC certified it. Why should I take the vaccine? Because NAFDAC has been working around the clock to ensure that the health of our people is premium in whatever we do. Why should I take the vaccine? Because NAFDAC is the only agency in the world that is using track and trace to monitor where each vaccine vial goes. And they now call it the Abuja principles. When the Moderna vaccine came from the US, we knew that the barcoding was not complete, so we had to have an emergency meeting to ensure we put the barcoding that will enable NAFDAC to track and trace. Our staff, about 30 staff, NAFDAC staff, have been working around the clock since Wednesday so that today will happen. But it's not just that. Any vaccine that comes to Nigeria, we have to test it. That is why you should go and take your vaccine, because we spend so much time on it.
So as such, all Nigerians will cooperate with the government and health workers by affording themselves the opportunity of taking the vaccine. Also, as National Assembly, we are working on Nigeria producing vaccines. Already since 2020, we have allocated resources to commence that process, and we are working with the Federal Ministry of Health. So just like my previous colleague has said, we are on the verge of producing vaccines in Nigeria. 10 billion naira was allocated in 2020 budget. In addition to that, we have Nigerians who are international community who are working with us, with our international partners, to ensure that we have a mechanism to produce vaccines. The process has already started before. We are only trying to move it forward, and I want to assure us that in no distant future, Nigerians will start to produce vaccines locally and will not depend on donations.
Acknowledge all the healthcare workers across our country that have been working so hard in this response and will continue working hard, and ask Nigerians please to keep supporting them as they deliver on these vaccines. As we start queuing up from tomorrow to get vaccinated, please be patient. Be patient with our colleagues, line up carefully. They will get to everyone. Across every state in Nigeria, healthcare workers are preparing as we speak to deliver these vaccines to Nigerians. Let's work with them, let's support them, let's encourage them. Let's not be disruptive, and let's really put hands together to continue working as we have from the beginning of this response. It's a big country. It's not easy to get to everyone in the next few hours. So people will have to be patient as our colleagues work very hard with colleagues in the ministries of health at the state level, state primary healthcare boards, local government workers, hospital workers, nurses, doctors, to deliver these vaccines safely. So today, as we launch the second phase of our vaccination campaign, really give a shout out to all the healthcare workers across the country that work for us every day, keep this response going, and from tomorrow we'll have the added responsibility of delivering these vaccines into arms across our country. So thank you very much.